Hello, anatomy friends. This is Dr. Alsop, and we will finish our discussion of the upper limb by talking about the rest of the muscles of the arm, the forearm, and the hand. And yet again, we have quite a few learning objectives to work through, but these are your guide for the pertinent information that will be fair game for the assessment. So make sure you are taking notes specific to what the learning objectives are asking you to do. And we are officially entering the world of muscle compartments. And these will be your best friends as they hopefully will help reduce the cognitive load a bit when thinking through actions and innervation. So, muscle compartments contain groups of muscles that share a similar neurovascular supply. So, the same artery supply and the same nerves innervate these muscles that are typically share at least some type of actions as well. And these are all wrapped together and enveloped in deep fascia, which is dense connective tissue deep to the skin and subcutaneous or superficial fascia. And in certain areas, that already dense deep fascia gets even thicker as it creates an intermuscular septa, which will extend from the rest of that deep fascia and actually attach to bone as well. So we will start with the arm. There is an anterior and a posterior compartment of the arm. The main actions of the anterior compartment of the arm are flexion of the elbow, or flexion of the forearm, you can hear it either way, and supination of the forearm, with the primary innervation being the musculocutaneous nerve, which is a terminal branch of the brachial plexus. The posterior compartment of the arm has a large muscle, which is the primary extensor of the elbow, and it is innervated by the radial nerve, which is another terminal branch of the brachial plexus. In fact, this nerve is the largest branch of the brachial plexus because it innervates all of the posterior compartments, so both the arm and the forearm. There are three muscles in the anterior forearm, and we're going to discuss two of them in more detail. The biceps brachii is the most superficial muscle in the anterior compartment of the arm. This is when you tell someone to flex, that's the muscle that tends to pop up in the anterior compartment. It has two proximal attachments. Both are on the scapula. That is why it is called bi, meaning two. And those proximal attachments come together to have a common distal attachment on the radial tuberosity of the radius. And so when you consider these attachments, you understand why this muscle is sometimes referred to as the three-joint muscle, or because it crosses and can affect the actions of three different joints. So this would include the shoulder joint, the elbow joint, and the proximal radio-ulnar joint. Its primary actions are powerful supination of the forearm, and when it's in a supinated position, it can play a big role in terms of flexion of the forearm. Now, the next anterior muscle of the arm, the brachialis, can flex the elbow in any position, supinated or pronated. And so this muscle really is the prime mover of flexion of the elbow joint. It is located just deep to the biceps brachii and is shorter than it, as its proximal attachment is on the humerus, not the scapula, with a distal attachment on the coronoid process of the ulna. And since it distally attaches on the ulna and not the radius, it doesn't play a role in pronation or supination. It, like the biceps brachii, is innervated by the musculocutaneous nerve. Moving to the posterior compartment, and it's really only composed of one really big muscle with three heads. The triceps brachii muscle, tri indicates the number three. So the three heads. So the long head is medial, represented in red here, and superficial. The lateral head is lateral and superficial. It's yellow in this illustration. And then the medial head is medial, as its name would suggest, but it is a bit deeper and it is green in this illustration. The primary, all three of these are going to have an attachment on the olecranon distally, and you can have an understanding of why the olecranon is so built up because this is such a large muscle that's attaching there. The primary action of this muscle is extending the forearm or the elbow joint. And since it is within the posterior compartment, it is innervated by the radial nerve. And so go ahead and do me a favor right now. Jot down in your notes, radial nerve equals posterior. Then say it a few times for good measure. That will help in terms of remembering these compartment innervations. Moving to the forearm, again, we have an anterior and a posterior compartment, but the number of muscles in the forearm goes up considerably in comparison to the arm. The anterior compartment of the forearm has muscles that will flex the wrist and the joints of the hand, and there will be two muscles associated with pronation of the forearm. The anterior compartment of the forearm is going to be innervated by the median nerve primarily. Again, another terminal branch of the brachial plexus, but there are a few exceptions, and I will highlight those as they come up in upcoming slides. The posterior compartment of the forearm will have muscles that will extend the wrist and the joints of the hand, and there'll actually be one muscle that will play a role in terms of supination. And we remember radial nerve equals posterior, so this posterior compartment is also innervated by the radial nerve. Many of the muscles in the anterior compartment of the forearm, particularly the more superficial muscles, have a shared proximal attachment through a common tendon called the common flexor tendon. And that will be the medial epicondyle of the humerus. And in this illustration on the right, it is showing that the tendon or the periosteum of the medial epicondyle can get inflamed or overused and cause something called medial epicondylitis, also often called golfer's elbow. All right, let's talk about some of the individual muscles in the anterior compartment. Again, we are not talking about each one. We do not have the time, so we will start with some of the more superficial muscles. And these muscles also have pretty long names, but they are descriptive. So let's take a look at this first one, the flexor carpi radialis, and break it down. Flexor means this muscle flexes. Carpi means the wrist region or carpal bones, and radialis means on the radial or lateral side. And that is exactly what it does. It flexes, and since it's on the radial side, it will play a role in abduction or radial deviation of the wrist. The flexor carpi ulnaris muscle will also flex the wrist, as its name suggests, and it is on the ulnar or medial side, so it will adduct the wrist or ulnar deviation. And the FCU is one of the few muscles in this anterior compartment of the forearm not innervated by the median nerve. Rather, it is innervated by the ulnar nerve. Yet again, another terminal branch of the brachial plexus. It has ulnar right in both of their names, so that makes sense. There is an intermediate layer in the anterior forearm, and it has one muscle, the flexor digitorum superficialis. It will have four separate distal long tendons that will travel through the carpal tunnel and attach to the intermediate phalanges of digits 2 through 5, and that's important there. This muscle will play a role in flexion in any joint that it crosses, so that would include the wrist, but its more powerful actions are flexion of the metacarpophalangeal or MP joints, but especially the proximal interphalangeal or PIP joints of digits 2 through 5. Deep to the flexor digitorum superficialis muscle is a very similar muscle called the flexor digitorum profundus, which also has four long tendons that also travel through the carpal tunnel. But these tendons go all the way to the distal phalanges. So we can probably have this highlighted a little bit more. You can see where the tendons go into the distal phalanges. So it can flex all the joints it crosses, similar to the flexor digitorum superficialis, but its most powerful actions are going to be the flexion of the distal interphalangeal joints, or those DIPs. In fact, this is the only muscle that will flex the DIPs of joints 2 through 5. This muscle has dual innervation. The medial side of this muscle is actually innervated by the ulnar nerve. That makes sense. The ulna is medial. And then the lateral side is innervated by the median nerve, like the rest of the anterior compartment. There are two pronator muscles in the anterior compartment of the forearm. The pronator teres is more proximal and superficial, and the pronator quadratus is more distal and deep. Both of these muscles have their distal attachment on the radius, which makes sense as the radius is the moving bone during pronation. Now we are moving to the posterior compartment of the forearm, and I'm going to start with a muscle that is considered to be part of the posterior compartment in most resources, but it has some strong anterior compartment ties, and this is the brachioradialis muscle. I say it has strong anterior compartment ties because it is actually a flexor, a weak flexor, but a flexor nonetheless. But it doesn't actually flex the wrist. It doesn't reach that far. Rather, it flexes the forearm. It is also quite visible on the anterior side of the forearm. It actually takes up the entire lateral side of the anterior forearm, even though you can see some of it on the posterior side as well. But it is considered part of the posterior compartment because it is grouped with other posterior compartment muscles with deep fascia, but also more importantly, it is innervated by the radial nerve like other posterior compartment muscles. The more superficial muscles of the posterior compartment of the forearm will share a common proximal attachment on the lateral epicondyle of the humerus. And if you have overuse or inflammation in this area, it is called lateral epicondylitis or tennis elbow. The superficial layer of muscles here will affect the wrist and the digits 2 through 5. And the deep layer of muscles will have muscles that primarily affect the thumb or the first digit, digit 1. If you see polysis, you need to be thinking the first digit. There are a few muscles in this deep layer that don't match the first digit thing. There is one that supinates, and there's one that directly affects digit 2. So let's talk in a bit more detail about some of those superficial muscles. There are two extensor carpi radialis muscles. There is a longus and a brevis. So one is longer than the other one. Both of these muscles will extend the wrist, and they will abduct or radially deviate the wrist. In the middle of the superficial layer is going to be the extensor digitorum, and there is only one digitorum muscle on the posterior side, and this muscle, as its name would suggest, is going to extend the digits, specifically digits 2 through 5. Then the most medial muscle on this posterior side will be the extensor carpi ulnaris. There's only one extensor carpi ulnaris, and it will extend the wrist as well as adduct or be an ulnar deviation of the wrist. Lastly, let's do a quick review of the muscles of the hand. There are very, very many of these. These muscles are what's referred to as intrinsic, meaning they have both their proximal and distal attachments entirely within the hand. And these help with the more intricate and precise movements that are so important in the hand. Most of these muscles are on the palmar side. If you look at your own palm and then look at the back of your hand, you can tell which side has more muscles just deep to the skin. And again, there are many more muscles in the hand we're not going to discuss, but I do want to mention two muscle compartments. The thenar compartment is located on the lateral side of the palm. These muscles are innervated by the median nerve, which is unique as most intrinsic hand muscles are innervated by the ulnar nerve. And these muscles are going to affect the joints of the first digit. On the opposite or medial side, there is the hypothenar compartment, another bulging but a smaller collection of muscles, and these will move the joints of the fifth digit, and these are innervated by the ulnar nerve. All right, we have finally reached the practice question. An individual comes into your clinic reporting significant weakness when flexing the forearm at the elbow joint. You determine that the nerve supplying the primary muscles responsible for elbow flexion is compressed. Which nerve is affected? All right, pause the video, and then when ready, let's discuss. So in the stem, flexing the forearm at the elbow joint stands out to me. So which muscle compartment does that? That's right, it's the anterior compartment of the arm. So then we need to know what nerve innervates the muscles in that compartment. Hopefully you are thinking C, musculocutaneous, as the correct answer. If you are, you are totally correct. It is true that the brachioradialis muscle can flex the forearm at the elbow joint, and it is innervated by the radial nerve, but it would not create significant weakness, likely, as the biceps brachii and the brachialis are the primary flexors of the elbow. Those are located in the anterior compartment of the arm, and they are innervated by musculocutaneous. So it is by far the better answer here. Excellent. Thank you so much for your time and attention.